I'm student clinician Joel Carrion. What is your name?
Selena.
Hi, Selena. So for today, the case is hand tingling bilaterally. Our differential diagnosis is thoracic outlet syndrome, ulnar nerve neuropathy, or C8 radiculopathy. We're going to be performing some tests to figure that out. Okay, so for inspection, we're going to be looking for upper cross syndrome on the patient. If they have anterior head carriage, if they have elevation of the scapula, winging of the scapula posteriorly. We're also going to be looking at their posture, their gait, and if they have any ambulation when they're walking. Okay, so now we're going to be starting with the orthopedic test. If anytime you feel hurt or not unease, please let me know. Everything you say will be strictly confidential. Okay. Our first test is going to be Roos test. So for this test, I need you to go like this, that position. I need you to close and open your hands continuously. We usually do this for 3 minutes, but for the purpose of this test, you can stop. Positives for this test will be ischemic pain, numbness, weakness, or tingling of the hands, which will indicate thoracic outlet syndrome on the side being involved. Also, the first test I'm going to do are going to be for thoracic outlet syndrome. Our next test is going to be Addison test. Okay, so for this test, I'm going to be establishing the radial pulse. I'm going to need you to look at the ceiling, look towards me, hold your breath. I had the pulse. Now rotate to the other side. Good. Let's do that on the other side. Establish radial pulse. Look at the ceiling. Look towards me. Look to the other side. Okay, you can relax. Positives will be pain or paresthesia and decrease or absence in the amplitude of the pulse, or pallor, which is loss of color. This test will indicate thoracic outlet syndrome, but by compression of the neurovascular junction by the scalenus anticus and the cervical first rib. The first rib, sorry. Our next test is going to be Addison test. So for this test, I'm going to stand up straight, extend your spine, look down. I'm going to establish the radial pulse. Take a deep breath and hold. Okay. You can breathe. Let's hear it again. Sit up straight, establish pulse, look down, hold your breath. Take a deep breath and hold. Good. You can relax. Okay. So positive for this test will be pain or paresthesia, a decrease or absence of the amplitude of the pulse, or pallor. In this case, it will indicate thoracic outlet syndrome, but it will be by compression of the axillary artery by the pectoralis minor and the coracoid process. Now we're going to do right test. So for right test, I'm going to establish the radial pulse again. I'm going to hyper-abduct the arm. I'm going to perform that on both sides. Establish radial pulse. Hyper-abduct. Positives will be pain and or paresthesia, decrease or absence in the amplitude of the pulse, or pallor, which will indicate thoracic outlet syndrome by compression of the axillary artery by the pec minor and the coracoid process. Okay, now we finished the test for thoracic outlet syndrome. Now we're going to be doing the test for C8 radiculopathy. I'm sorry, for ulnar nerve, neuroma of the ulnar nerve. Okay, so can you turn around for me? This is my Taylor reflex hammer. It is used for that reflex test. It's going to be tapped like that. Okay, maybe it's going to feel a little tingling and weird. I'm going to be looking for the groove of the ulnar nerve. to tap. I'm going to perform this bilaterally. Positive for this test is pain, tenderness, and or paresthesia at the site being tapped in the ulnar nerve distribution area, fingers 4 and 5, which will indicate neuroma of the ulnar nerve. Now, you turn around facing the camera for something. Now we're going to be doing the test for the C8 radiculopathy. Our first test is going to be foraminal compression. I'm going to place my hands on top of your head and do some downward pressure. Is that okay? Mm-hmm. Let me know if there's any pain. I'm going to pressure here. I'm going to rotate to the right, downward pressure, and rotate to the left, downward pressure. Positives will be two positives: exacerbation of cervical pain locally, which will indicate foraminal encroachment or facet pathology without nerve root compression. The other positive is exacerbation of cervical pain with a radicular component, with a radiating component, which will indicate foraminal encroachment or facet pathology with nerve root compression. Our next test is going to be Jackson compression. So for this test, I'm going to do the same downward pressure, but I'm going to lateral flats. Let me know if there's any pain. Compress down here. Compress down. So positives will be exacerbation of local cervical pain, which will indicate foraminal encroachment or facet pathology without nerve root compression. The other positive is exacerbation of cervical pain with a radicular component, which will indicate foraminal encroachment or facet pathology with nerve root compression. Now, our next test is going to be maximal cervical compression. So for this test, I need you to rotate your head, laterally flats, and look up. Any pain with that? Rotate your head, laterally flats, and look up. Any pain?
No.
No. So positives will be pain on the concave side, which will indicate foraminal encroachment or facet pathology with or without nerve root compression. It's going to be depending if there's any local pain or if there's any radiating pain involved. Now, our last test is going to be cervical distraction. I'm going to be, instead of pushing down, I'm going to be pushing up a little bit. Let me know if there's any pain in this, okay? I'm going to establish here. I'm going to distract up. Okay, so positives here will be, so we'll distract up. Positive will be here, decrease of local pain, decrease or absence of local pain, which will indicate foraminal encroachment or facet pathology without nerve root compression. The other positive is decrease or absence of pain with a radicular component, which will indicate foraminal encroachment or facet pathology with nerve root compression. And the other indicator will be an increase in pain, which will indicate muscular strain, ligamentous sprain, myospasm, or facet capsulitis. Okay, we concluded with the orthopedic test. Now we're going to be doing our reflex test. So first, we're going to be doing the reflex for the tricep. Okay, can you look the other way? Take a deep breath. Checking if there's any reflex. Look at the other way, take a deep breath. Okay, now we're going to do the biceps tendon. Again, relax, take a deep breath. Biceps tendon. Now we're going to do brachioradialis. Brachioradialis on the other side.